Our next session is called Closed by COVID-19, Exploring the Relationship Between Government Pandemic Response and Downtown Recovery in Canada. And it is my pleasure to introduce our speaker, Karen Chapple, who is the director of the School of Cities and a professor in the Department of Geography and Planning at the University of Toronto. Chapple studies inequalities in the planning, development, and governance of cities and regions throughout the Americas. And in summer 2022, Professor Chapple launched the website www.downtownrecovery.com to track pandemic recovery patterns in North American downtowns. Chances are, if you've read a news story or seen a report about pandemic recovery in downtowns in North America, you've become familiar with Chapple's work. She is a professor emerita of city and regional planning at the University of California, Berkeley as well, where she served as department chair, and she's the recipient of multiple awards, including the 2023 Regional Studies Association Sir Peter Hall Award for lifetime contribution to the field. She holds a BA in Urban Studies from Columbia University and an MSCRP from the Pratt Institute, as well as a PhD from UC Berkeley. We are really honored to have Professor Chapple here today to talk about her work on COVID recovery and downtowns, and to share some of the most recent findings from her Downtown Recovery Tracker project. So thank you very much, and please join me in welcoming Professor Chapple.
Thanks so much, Ashana, for the kind introduction, and I'm really honored to be here today. I've been excited to watch the emergence of the Institute for Pandemics, a big supporter, and great to see it all come to fruition today. So I'm going to talk today about downtown recovery. I just want to mention that all of my work is teamwork. So I have a set of postdocs and researchers, some of the teams at University of Toronto, some of the teams at Berkeley, some of the teams at MIT. So it's a truly international collaboration. So this is work, again, that we started really as the pandemic was unwinding, and we realized that there was an opportunity to study recovery really in real time. So you may remember this, downtown Toronto, 2020, March. This is what it looked like. And what we're concerned about is that some downtowns still kind of look like this 3 years later, 4 years later. So we took the opportunity to use cell phone data to study the issue of recovery, to look at activity downtown, and to compare it to activity throughout the region and throughout US and Canada in the top metropolitan areas. And we like to use cell phone data for a couple reasons. Most of the indicators we're seeing about recovery tend to be partial indicators. You might see data on transit system recovery. You might see data on retail sales. You might see data on office vacancy rates. Office vacancy rates are a proxy, but they don't give you the full picture, because even if people are holding on to their leases, and some are leaving their leases, their workers are changing their habits. They're changing their activity. They're changing how often they come to the office. So vacancy rates is actually a bit of a crude proxy, because you'll have a number of folks holding on to their office space, yet their workforce has gone to 3 days, 2 days a week remote. So we use this stop data. So basically we're tracking all the cell phones. We're tracking residents, workers, shoppers, visitors, anybody with a cell phone that has location services turned on. And we're looking at their stops. So we're looking at basically where they stay for more than a few minutes. So we're not catching cars driving through. We're catching people engaged in some activity. this is what that might look like in downtown Toronto on a particular day. So to give you a sense of how this indicator works, let's just walk through some visualizations of downtown. This is downtown Toronto in red. This is the entire metropolitan area. You can also see Mississauga in red. So this is before the pandemic. This is after the pandemic strikes. And this is as recovery begins. So going back, this is where we start. So you'll see downtown is a spike of activity. There's also a spike of activity in Midtown Toronto. Pandemic hits, actually that spike is still there in Midtown, but it is gone downtown. Recovery comes and you start to see some activity come back to downtown, but an interesting thing has happened. That activity is now dispersed throughout the metropolitan area. And essentially, this is where we are still at today. Maybe downtown has come back a little from this, but we're still at this point of a fair amount of remote and distant activity from downtown. So when we're studying downtowns, first we have to define what a downtown is. And this turns out to be an exercise in and of itself. There isn't any kind of established definition of downtown. There's an old one that Stats Canada put together. There's an old one that the US Census put together. They're different. It makes it impossible to look across the two countries. Then there's also a set of administrative boundaries that different downtowns use, but each downtown defines it differently depending on the businesses and their interests. So we ended up using a job density measure. So what we did was we used the job densities that we could calculate by block in both Canada and the US. We figured out where those jobs were, and we drew a polygon around them. So we have the densest area in the center of each of the biggest metros in US and Canada. And then we came up with a simple metric. Basically, we're looking at activity rates. So we're looking at how much activity there was before the pandemic, and now we're comparing it to activity today. So it's a percentage. So what percent of the 2019 activity has come back? So this rate actually makes it simple to do kind of a ranking, and everybody loves rankings, and you and I know that they're a little bit bogus. There's always a problem with the ranking, but ours turned out to kind of resonate because this phone measure is actually a great reflection of what people are experiencing on the ground. So this is our overall ranking, just to orient you to where the metros stand. Think about the colors. So yellow is the southwest of the US. That's the area that came back fastest. Light blue is the Midwest of the US. That's the area that's come back slowest. And green is the Northeast of the US. So Canada here is actually doing pretty well relative to some of the other metros. But on the other hand, well is relative. So the median recovery rate is 74%. So 3/4 of the activity from before the pandemic has come back. Losing 25% of your activity is a big deal for a place. It's a big deal for an economy. It's a big deal for all the small businesses that were relying on customers. So it's still a very big concern. Just to zoom in here, you can see, again, the ones that top our ranking are places like Las Vegas, places that thrive on entertainment, places with clement weather. We also have places that have more diverse economies, as we'll see in a bit. So one thing we wanted to do to put North America in perspective was to look at where we stand relative to Europe. And this is another way of kind of seeing how we're doing on this continent. So in yellow are the European cities. Canada's in red again, and the US is in blue. And so European downtowns are very different animals from North American downtowns. They were developed at different times. They were not developed around the steel-framed skyscraper and the transit system, right? They had historic and cultural origins. And as a result, they have bounced back, they have surged back at a much faster rate. And you'll see the European cities that lag, Milan and London, are the ones that actually have financial districts, have an over-reliance on office work. So that vulnerability, it seems to be global. So coming back to Toronto, we've used this data to look at various aspects of recovery. One thing that's of interest to us is again, the dispersion of activity. So blue here is where districts have recovered, red is where they're still suffering. And you can see here that the neighborhood commercial districts are actually doing pretty well, particularly the further out you are in the north, in the west, you're doing very well. And then downtown, of course, is where recovery is lowest. And another way of looking at that is over time, the bold line here is the downtown district. All the other commercial districts are actually doing pretty well, and some of them are back at 120%. So they're really roaring back compared to downtown. So something is amiss in the downtown area. So let's zoom in on downtown. So we can also look at recovery rates on a building by building basis over time. And again, blue is good and red is bad. And you'll see that most of downtown is really suffering, downtown Toronto. The big blue bar at the bottom, that's Union Station. If you've been there lately, you'll see that it's basically back. And some of the other buildings at the northern edge of downtown are doing well, but there's a great number of buildings that are really struggling in the heart of downtown. The Washington Post took our work and asked us to look at a very micro scale. And this is what you can do with phone data that you can't do with other sources of data. It's super interesting. So they were curious why downtown Cleveland was coming back. And so we ran some numbers for them. And you'll see in the right panel there, the areas in brown, those are where the residential conversions are, the conversions of office to residential. And there's positive activity there throughout the day, through working hours and also after working hours. And that's actually driving the comeback of the downtown. So this type of work gives you a real clue what to do to bring your downtown back. Just a couple more slides about where we're going, and then I want to talk a little bit about the health response and linking it to the downtown recovery. Another way that we can look then at the data is working hours versus after work hour activity. And so the dot on the right is the after hour activity. The dot on the left is the working hour activity, and the overall recovery rate is in the middle. So you can see that a place like Tucson has a after hour recovery rate of 130%. It's booming at night times, it's booming on weekends, and yet its office working hour activity Monday to Friday, 8 to 6, is about 40 or 50%. So in many cities, you see this extreme dispersion that you see great recovery in the downtown on the weekends and a real struggle to get people there during the work week. Finally, we looked at transit recovery, and we found that transit systems are going hand in hand with downtown. Surprise, surprise. So a lot of transit systems are really in a hub and spoke type geometry, which is serving downtown, and those are struggling along with the downtowns. And our latest kind of update on this work is looking at the last year, looking at trends over time. And this is sort of a good news picture, well, a good news, bad news picture, that we have about 50 cities that are trending up. So the recovery rates are going up over time. And Toronto is among those cities. The bad news is that in general, they're not going up much at all. They're kind of hovering around where they were about a year ago. So there's going to have to be more work done to get our downtowns back. Okay, so now I want to go into the why. So why did some cities come back while others have really struggled? And then what did public health measures have to do with the recovery rate? So we ran a set of random forest regression models and threw a number of different variables in. We had variables about demographics, socioeconomics. We had variables about urban form. We had variables about the composition of the economy. We had political variables. And we had the Oxford Government Response Tracker, which is a marvelous source of data on how different states and provinces you adopted different public health measures in response to the pandemic. And so we're able to use that data looking at the number of days that a measure was in effect, say a mask mandate or a school closure or a workplace closure, and use that to predict downtown recovery. So let me walk through some of the effects of our model. And I know you can't read this, but I'm going to zoom in on it in a second. What I want, this is just to really point out the great number of variables that had an impact, but some of them were very important. So just to orient you to the visualization, red means a negative impact, green means a positive impact. So it helped recovery. So zooming in, what we find from this research is basically it's the economy, stupid. So it turns out that if your downtown was overly concentrated in professional, scientific, and technical sectors, if you had a lot of workers in finance, if you had a lot of tech workers, you were more vulnerable when the pandemic came around. And so we see a situation where over half of our top variables and over half of the variation in recovery rate is explained by economic variables. So that's the main thing. And the ones working in conjunction with them are variables on density and commutes. So commute time turns out to be super important. If you have longer commute times, and Toronto has one of the longest in North America, your recovery rate is going to lag. So what's happening is that people have the choice now of working at home or going to work. If you have a 90-minute commute, you're more likely to make that choice to work at home, and that's affecting downtown recovery. And it's affecting, of course, transit systems as well. And then we also find that densities matter. So that early out-migration from density, everybody said, I'm scared of being in places that are dense, in places where with residential or worker density. That's still true. That's still having an effect. People are still more comfortable in less dense places and more auto-oriented places. So then to get to the health factors. So about 10 or 12 of the health responses come up in this model. They account for about 10% of the variation in recovery rates. So in other words, it wasn't your fault. Okay. Most of what's going on is about the economy, and the health measures affect downtown recovery on the margin. It's really about whether your economy was diverse or over-reliant in tech and professional workers. So what matters most here in terms of the comeback, so green is vaccination. So when vaccination was available to broad groups of people, that has helped downtowns come back. The longer those vaccinations were available, the quicker downtowns came back. On the negative side, small gatherings, closure of public transport, those have impacted downtown recovery in the long term. And we'll talk about that more in a second. With a lesser impact is masking regulation, workplace closure, and public event cancellations. And the one good factor here is income support, and I'll talk about that more in a second, but that has helped, us downtowns come back. And then school closures, large gatherings, and at-home requirements had a very, very small impact. So altogether, with all of these measures, we're accounting for about 10%. So let's dig in a little bit. And so this is a regression that's really just looking at recovery rates as a function of the health measures to sort of get a better sense of what really mattered. So again, vaccinations. Having universal availability of vaccinations was really, really key. The quicker that came in, the quicker the downtowns came back. Number one, in terms of a negative factor, again, is the small gatherings, the restrictions on small gatherings of fewer than 100 people. That has had a long-term detrimental effect. And again, probably more research is needed to figure out why exactly. But that measure seemed to impact. Workplace closures were also impactful when you just look at these health measures in relative perspective. One of the interesting things is that closing some workplaces had sort of basically the same impact of closing all workplaces. And I think that the reason is if you close some workplaces, you're disrupting family routines in a way that it's still upsetting that downtown commute. So it has just as much of an impact as closing all workplaces. And then public events cancellations is fairly high up here. And then comes school closures, at-home requirements, and then again, mask mandates are at the end, very small impact. And I just want to break this down a little bit more before we wrap up. So looking year by year, so we can actually break down the results and run the regressions for 2020, 2021, and 2022. So in 2020, the main impact on the downtown's ability to come back for that year was the stay-at-home requirements. And then income supports were the major positive factor. So what happened is that the governments that were providing income supports to workers and were allowing them basically to continue as usual in some way and keep activity going in the downtown. So I think this is a super interesting finding from a policy perspective, that we just want to keep that economy going, even if we're shutting down activity for health reasons. And then again, in the beginning of the pandemic, the workplace closures and even the mask mandates had a extreme impact. Going to 2021, it changes a little bit. Small gatherings become the big issue. The restrictions on small gatherings seems to really hinder people coming back downtown. And then the super positive factor is the vaccination availability. No surprise there. And by 2022, we just have a few factors left. The 2022 sample is very small because it's really just Omicron. Remember Omicron, January 2022. And at that point, again, it was the restrictions on small gatherings that was primarily hindering downtown from coming back. And then for some reason, the mask mandates seem to have a role as well, discouraging people from going out in public. Okay, so I'm going to wrap up. When I give this talk to a downtown audience, usually I'm talking to a bunch of economists and planners, not health folks. And so, you know, the punchline being, it's the economy, stupid. It means that you need to diversify your economy. You need to make sure you have a 24/7 economy going. And that means having all sorts of uses downtown. And it means having essential workers downtown, people that will be there throughout the pandemic, and they'll be keeping the downtown going as well. So we're talking about health workers, education workers, government workers, keep them all going, manufacturing, and so forth. The cities that had those diverse economies full of essential workers are the ones that pulled out first, and they're the ones that have continued to to climb back up in recovery. We need to make it simpler to convert buildings to residential use, or even for startup incubators or other types of uses. Again, we need to make sure our downtowns are inclusive and affordable to keep people downtown. And then we need to think about how to kind of double down on transit and make sure we have fabulous transit systems that are keeping people out of their cars, even though they prefer them right now. And then vaccinations. So public health measures. We need to think, obviously getting those vaccines out quickly is really key for the economy. There are a number of other measures that we really need to think carefully about in the next pandemic. I think how we restrict small gatherings, what are the rules around that is going to be really important for preserving economic activity. We need to think about closures and the fact that limited closures seem to have the same kind of disruptive impact as all closures. So maybe it's better to close everything, but for a very short time. Limited closures seems to be quite harmful. Canceling public events, of course, as expected, had a significant impact. And then mask mandates might, they're very minor impact relative to everything else, but can have a little impact. So our downtowns are for people. Jane Jacobs told us that in 1957. It's taken planners that long to figure that out, that we need to make downtowns hospitable to people. We need to have them be social connectivity districts, as our colleague Richard Florida likes to say, in order to keep them resilient and keep the core of our economic regions going. This is the website downtownrecovery.com. I bought that URL for $3 in 2021. It's now worth $1,500. So good investment, and it will continue to be a good investment, I think. So thank you.
I'm going to invite Karen and our panelists to come and join us up at the front of the room, please. We have two further panelists joining us. Dr. Renzo Calderon-Añosa is a postdoctoral fellow with the Institute for Pandemics and the Institute for Health Policy Management and Evaluation. And Dr. Eileen Davila is the Medical Officer of Health for the City of Toronto, a member of IFP's advisory table, and I would add a great friend to the university, and the entire city owes her an enormous debt of gratitude for her leadership during COVID-19 and beyond. So thank you, and please join me. We will be hearing from each of our panelists a brief response, and then we will have a Q&A period.
Hi, everyone. Hello. Hello. Okay, perfect. Thank you very much for the presentation. It was really interesting to see. My background is not in city planning; it's in epidemiology and public health. So it's been really interesting to see that how diverse this work has been. And I guess one of my first comments or questions regarding this work was related into you show us this picture of the change and how after the pandemic the distribution of the density was spread throughout the city, right? So the downtown kind of didn't came back to what it was, but there was an increase in these other areas. And at the end, you show that there are some factors associated with that downtown semi-recovery or impact. But I was wondering if you can tell us something about what make these other places thrive or got higher levels of recovery than before. Not only looking at downtown, I know this is downtown focus, but I was wondering like what make these other places also increase in that sphere.
Sure. We're actually looking at this in a study with you. But we believe that my hypothesis is that the neighborhood commercial corridors that are adjacent to neighborhoods with concentrations of hybrid and remote workers are the ones that are thriving the most. And yeah, so I think we'll see that people's shopping patterns changed quite a bit as they began working 3 days a week at home.
Yeah, and that actually is a good jump to my next question, because you mentioned that the recovery in some parts was due to this shift into the economic sector as the main driving for this. And I was wondering if there could be also different data that we could use to see how that shift went from the in-person kind of shopping or economic or market to the online presence. I know you use cell phone data, and nowadays we use a lot of delivery services for food or for getting resources. So I was wondering if we can also use that type of data to see how it compensates. We might not see the downtown like lively as in place, but it might be lively online. So I was wondering if if it's worth looking at this other type of online presence also.
Yeah, I would love that. If anybody has that data for Canada, we have that data for the US, and we're able to see that it's increased by about 50%. Online shopping went from about 10% pre-pandemic of all shopping and to 14 or 15% post-pandemic. So that's a big impact.
Oh, sure. Yeah. So part of my research is looking into mental health and how it shifted throughout the pandemic, or how the different health service use trends were affected throughout the pandemic. So as Karen said, we're interested in looking how this recovery, or where this places the recovery, had an impact onto all the population mental health. There for sure is an effect going from work every day to starting working from your house. Um, and also being exposed to the commute and being not exposed to the commute. So basically that's my research area, trying to see how these types of shifts throughout the pandemic affected mental health persons, specifically children and adolescents. So that's where I'm also interested in this. So I guess that leads to my last questions in terms of measurements and biases. We know there are different populations affected by this, and when looking at this type of data, specifically for cell phone data, we might incur in some form of biases when we try to measure these type of things. So I was wondering if you can just comment a bit on that. Thank you.
Yeah, there's not that much known about the biases. A few studies have shown, interestingly, that some of the groups that we think of as marginalized, low-income groups, racialized groups, even seniors, are actually overrepresented in this sample. Why? Because maybe they don't turn off their location services. I know my mother doesn't, so it rings true to me. But yeah, but I think it is a black box, and it changes over time, and we're dependent. I mean, you'll notice we showed a slide for the last year that we're looking now at trends. That's because our cell phone provider changed, and we don't even know whether it comes from Rogers or you tell us. That's all a black box to us. And so you think about, like, how do you choose Kudu versus Freedom? Those markets are quite different. We just don't know. It's a black box.
Yeah, thank you.
Thank you. We'll turn it over now to Dr. DeVille.
So thank you. And first, thank you, Karen, for a very fascinating talk. Thank you to the organizers for allowing me a few minutes to be up here on this stage. I do want to say what a fascinating presentation, data that I had not had the opportunity to take a look at before. And of course, I come at the data from a very different perspective. I'm not a researcher. I'm a local public health practitioner. So it's all about local public health practice as far as I'm concerned. And clearly, my role is to, as we heard from Dr. Jha this morning, to provide the best advice possible to decision makers and occasionally to exercise some decisions directly ourselves as local public health. So first and foremost, Karen, there are a number of other public health practitioners here. So I will first thank you for the therapy. Right? There was a therapeutic moment, I think, for those of us who practice in public health to hear, and if I can, quote you, it's the economy's stupid. It wasn't actually, all our fault. And in fact, there was a relatively small proportion of that which we're experiencing now in terms of downtown activity that is left at the feet of public health practitioners. So, I don't know whether I should pay you or, I don't know, take you out to dinner, but there was certainly a therapeutic moment and a sense of validation, I think, for many of us who practice within the realm of public health. I think when I look at your data, and again, this is a very first glance at it, not a very, very deeply thought out opportunity to look at the data. But when I think about it, and I think about the kinds of things that you presented here to this audience, and what we heard from Dr. Jha this morning, there is a significant component here, yes, about what we do at the moment of a pandemic when we are actively responding to a new infectious disease threat. No question that that's important. I would argue what we have continued to hear over and over again, and I think the challenge that lays before us as public health practitioners is to remind people that the best response is actually a healthy community in the in-between periods. And I think that was, as I looked at what you presented, that's what came forward to me. You talked about the policy implications, the kinds of things that actually give rise to a vibrant downtown, a downtown for people. Those are the very same things that I think we're constantly trying to promulgate as public health practitioners. How do we make vibrant, thriving cities? Yes, downtowns, but frankly, my goal, my desire is to see every corner of this city vibrant, thriving, and a place where people can actually reach their full potential, regardless of what that is. So Sean, I'm going to leave it at that for now.
Thank you. Thank you very much. We are now, I'm going to lead off with a question, but we welcome questions from the audience, and I know that there are many. I see a lot of nodding heads. I have 6 questions, but I'm just going to stick with one to start. And the first question I have is, if we had an opportunity to go back in time to March 2020, knowing what we know now, right, having the sort of the insight and the knowledge, what would you recommend we would do differently in Canada and in Canadian cities? And what did we do that that you would recommend we continue to do?
So Shauna, I think that's a great question, and I'm sure you'll get, if there are 100 people in this room, you'll probably get 120 different answers. But I'm going to go back over and over again to the fact that, we heard a lot of this from Dr. Jha. There's no question. There are many aspects of the response that we need to constantly improve on. Right? We learned about the kinds of things that actually make a difference within the context of a response. But I cannot emphasize enough that the resilience, whether it's time to recovery, I have to admit, colleagues around this room, I am not a big fan of the word recovery. I think recovery means that we're going, it's traditionally looked at as going back to a state that we were in before. I'm not sure. I think, and that has assumptions premised, or it's got underpinnings and assumptions associated with it. I'm not convinced that the before time was better. I think we constantly need to be evolving to something better. So I challenge the group to come up with a better word than recovery. I kind of think of it as establishing a new and better equilibrium. I think that's where we need to go. But I realize that doesn't start with R, and therefore doesn't go as well with response and resilience. So I'm working on it. I haven't quite figured it out yet. But again, to my mind, the healthy societies in the in-between periods and between the crises, we know the crises are going to come. We know they're going to be of different varieties. It may be an infectious disease agent. It may be something related to climate change. It may be something related to human conflict. But the ability to respond well and the ability to actually be as healthy as we can be in the face of whatever the challenge of the day is, rests on actually having healthy communities to begin with. And frankly, that takes, we've heard a number of people, it takes investment, it takes effort, it takes good policy to actually create environments that allow people to reach their full potential, and for communities to actually have a sense of connectedness and a sense of real belonging and real opportunity to enjoy good health.
Thank you. I'm going to pass it over to the other two panelists. And also, in addition to the excellent list you just added, I would say it also requires data. And I think our panelists can respond to that.
Yeah, so I love that question, Shauna, going back in time. So, again, I think public health officials got it right. And I think our data shows that, so people initially in 2020 were saying, the Canadas of the world and the Californias and the New Yorks and the ones that were very strict and closed down things for a long time, that they're really going to struggle. And, Texas and the Southwest, they're going to bounce back. And they had data that first year, you could see Dallas came back much quicker than Toronto in 2020. But in the long term, by 2022, 2023, Dallas and Toronto are in exactly the same place in terms of office vacancy. So again, because it was about the economy and hybrid work, it wasn't about those health measures. So go ahead, do it. Ban the small gatherings, close down workplaces, fine. One thing you can't do again, which is shut down transit. And in fact, you have to double down on transit during the pandemic, run more frequent buses service and transit service so that people can space out in cars and not be overcrowded. But, sustain those systems, I think, through the pandemic is really important.
So just to be clear, transit was not shut down. I think the frequency, yeah, so it is a different issue. So just to be clear on the context here, transit wasn't shut down. There clearly were changes, I think, made. And to be honest with you, I can't speak to those specifics of those. I imagine the service levels might have changed, but it did not actually shut down in this city anyway.
I was using my lip reading skills, and I think I saw a few people also say schools. I wonder, Renzo, if you could talk about that, especially in the context of the work that you're doing.
Sure. So I think it's an interesting point, and two of the things that I think repeated in the morning session and this session was related to vaccines and masking and how that could make a change. As we saw from Kara's presentation, that for sure is one of the factors. But also coming back to the first session, it's something that we don't know. It's something unknown. So many times the only thing that we are left to do is just shut down everything. And for me, it's interesting because I lived the first half of the pandemic here in Canada and the second half in Peru, in Latin America. So it's interesting to see those two different ways and how strict the measures were. And from the public health and from health service delivery, I think that we have learned from this experience that we need another way that we can deliver services. We are now trying to implement services that don't require people to move, because that for sure we know that might not be an option. So people move. So how can we get the services to the people's houses, to where the people are, to the people who work? So I think that's another thing that we can work with.
Thank you. Do we have questions in the audience or online?
Thank you. So firstly, to do something? Oh, okay. So firstly, hello, my name is Mary Jo. I'm a community advocate. Karen, I really appreciated your presentation. It's actually a really important thing to be discussing. I guess I'm just wondering, with the pandemic and how many things it shone light on as things that need improvement, one of the biggest things is the improvement of air quality indoors. At what point will public health overtly embrace and invest in and educate on the need to improve the air indoors in businesses, which will ultimately help recovery, in healthcare, in schools, on school buses? It is really inarguable that more has not been embraced and then really communicated to the public and to businesses, healthcare, et cetera, how crucial that is to making things better in a myriad of ways, including preparing for future pandemics that are airborne. So I'm just wondering, when do you think that time will come?
So thank you for the question. I don't know that I will be able to provide an answer that will be entirely satisfactory. But I will say this. It's being worked on. It's an area I think where clearly there's room for improvement. And I think there are many of us who are interested in constantly moving the needle or the yardstick forward. It is, I think we heard this morning about the current environment within which we're operating, the amnesia that, is impacting, I think, many of us, not all, clearly, but it is a very real phenomenon. So it will take, I think, ongoing efforts and time. I wish I could tell you that I'll have it all wrapped up, no problem, by the end of the year. But, please know that there is interest. Not everybody has amnesia, and there is ongoing work on the subject.
Thank you. Do we have please go ahead.
Hi, I was a little shocked, perhaps not quite that, but that your study showed that masks had a negative, although small, impact on the downtown recovery. I'm just wondering, thinking about it, people who have to wear masks or want to wear masks perhaps are more emboldened to go out and maybe travel downtown. So I'm just wondering if that's just because masks are correlated with something else, or if it's a real effect, or how did you tease that apart from other factors?
Yeah, that's a great question. And by the way, you guys are the first to see this research. We will get it peer reviewed and published eventually, but so those are the types of questions that my reviewers are going to ask. So thank you. So the mask variable is looking at mask mandates, not at people actually wearing masks. And so obviously people wearing masks is going to help downtown be more resilient. But the mandates seem to have a little bit of a discouraging effect on activity for those that don't want to wear them. But again, it was tiny, very, very small. So, and I think to me, that's encouraging. It means that we can do mask mandates without hurting our economy.
Ted?
Yeah,
With
there's
an
a
online question, and then David.
online question from Omar Khan. Says, great talk. I'm curious about how this relates to housing types and polycentricity. The continued desire to leave denser areas post-pandemic seems to be at odds with the drive to intensify land use and create denser housing. Oh, sorry, you're going to be louder, and I hate microphones. The continued desire to leave denser areas post-pandemic seems to be at odds with the drive to intensify land use and create denser housing. Should we be creating low-density housing and better transit links?
Yeah, well, so planners want to continue to densify cities in order to reduce our greenhouse gas emissions and have livable 15-minute cities and high quality of life. I think we're still studying this effect of the pandemic, this dispersion effect we saw, the shift of people to rural and small town areas and exurban areas. But the early verdict, so right now in the last year, we've seen everybody kind of come back. I think that's where the data is probably going to land, is that it was a temporary shift, not a permanent shift. That's not to say that some people don't want to live in suburbs. Yeah, half of us want to live in suburbs. It's just that, we need to continue to make it a choice for the other half of us that want to live in cities, to live there, to make them affordable. And
Thanks very much for that. Let's see. Dr. Jha talked a little bit about trade-offs. And I'm wondering, it often is the economy stupid, but as a physician and a public health researcher, to me, there's economic value in health and in human lives. And we even assign monetary values to lives saved or to quality adjusted life years gained. In an analysis like this, how important is it to talk about the trade-offs and what didn't happen? So you can talk about the difference between the area under the curve between Toronto and Dallas, where Toronto may have transiently lost economic gains crudely measured. We published about a year ago work looking at the Canadian versus the US COVID response. We'd estimate if Canada had gone the route of the US, about 100,000 more Canadians would have died, and about 500,000 more Canadians would have been hospitalized for COVID. I think the economic value of that, as we estimated, it was something like $40 billion. We published a couple of weeks ago work on mask mandates in Ontario, where we would estimate that mask mandates, after we adjust for, you mentioned kind of differential recognition of cases, after we adjusted for the fact that if you look at Ontario's crude case data, it looks like a pandemic that mostly hit nursing homes because the cases are disproportionately women aged 80 and over, and that's because of who's in long-term care. Once you adjust for that, mask mandates appear to have saved about 3,000 lives in Ontario. They seem to have reduced our initial epidemic size in that first year of the pandemic by 50%. So we would have had 600,000 rather than 300,000 cases. And that, again, we're able to put a dollar value on of about $600 million in terms of averted healthcare costs and in terms of conventionally used values for quality adjusted life years gained. So, to what extent do we have to look at data like this kind of more holistically and treat it as the explicit trade-off that it is and that it was?
I love that point, and maybe you want to weigh in too. Yeah, I mean, it goes back to this whole idea of how we measure our economy, right? And should we do a whole life accounting framework rather than a kind of narrow jobs and wealth creation framework? And I think if we did, we would get some really interesting findings like this. And I think one of the things that we see in our data is again that activity dispersing. So you could talk about the diminishment of downtown economies, but you could also talk about the resurgence of small town and neighborhood economies, right? Glass half full versus half open. So we ought to be. You want to follow up?
Just very quickly, one thing that did strike me as a physician is our geriatric colleagues talk about the idea of frailty. And I wonder if that's ever something that's applied to cities. When we apply it to people and illnesses, the idea of frailty is that someone is cruising along and managing, and then there's a shock, there's an illness, and frail people don't recover from the shock. So frail people, non-frail people may be functioning at the same level ex ante, but I agree, I don't know robustness. I'm not sure what the opposite is, but to what extent is that concept in kind of the urban planning science space? This idea that that bounce back or non-bounce back, vulnerability to collapse if you're stressed is part of a healthy city.
Resiliency studies.
Yeah. Yeah, I would agree. And I think, we're I'm struck by the fact that we often do pose, that public health is somehow in opposition to strong economies. That I think is often a premise that people start with. And I would argue that it's completely wrong, right? We do need to think in a more holistic way and look at, there is no such thing as a good, healthy economy without strong, healthy people and opportunities for people to actually reach their potential. It goes into planning. I think there's really important conversations that need to happen there as well. But this is a much longer conversation, and I'm getting the feeling that I'm getting a hook.
No, you're not getting you're not getting the hook. David, I was going to add that, although we may not have the same concept of frailty, there is resilience, but also there is capitalism and the value of downtown real estate. And we are starting to see more pushback and tension between the owners of capital and the owners of those buildings that have trillions of dollars of value even in individual cities versus workers, employees who say, why should I go back to your office just to help your downtown when I'm very happy in my apartment or in my home or in my, at my farm. And so there is this tension, and we're starting to see an elevation of this debate as well. Jeff.
So just a quick comment. I work in the recovery team, and we are victims of alliteration. But I think our tagline is build back better and fair. And I think that's where we're trying to head. And this relates to some questions earlier. How do different communities in this city do? Like, those graphs showed us the geography, but that geography also there's lots of inequities in wealth and resilience across the city. Do we have a sense that some people have the sense that the recovery is favored, the rich got richer, the poor got poorer? Does that play out at the city level? Do you have any information? But I know you had some census data. So I'm finally getting to my question. What do you think about the equity impacts at the community level of the pandemic and our recovery?
So, I think a really fulsome answer to your question, Jeff, would require several hours, if not days. But a couple of things. There's no question that, our experience through the pandemic itself basically took all the challenges that were pre-existing, right? The inequities, and took full advantage of those. There's no question. But I think that the real answer to your question is not, it's just not that simple. It's not as simple as, the rich got richer and did better and the poor got poorer. In fact, I think if you listen to some of the comments that we heard from Camille, there were some, there's no question, there were socioeconomically challenged, racialized individuals had a very difficult experience through the pandemic, suffered a lot in respect of illness rates and so morbidity, mortality, et cetera. And at the same time, we saw some real strength, community connectedness, people pulling together, actually really delivering the kinds of services that people need in their everyday lives, and particularly in the moment of a crisis. So it's a far more nuanced, far more complex picture that we can't just simply write off, in a, yes, people who are socioeconomically better off had better options, had opportunities to access vaccine, were more protected, could work from home. There's no question that's part of the equation, but I think there's much more there in terms of strength and real capacities that we saw within communities all over the city. And I think the challenge that's before us is how do we continue to cultivate that, and as well to demonstrate to the communities that actually suffered the most that we're here. And we're not just here coming at you with vaccines. We're actually here for you on an ongoing basis, trying to figure out what matters to you and how can we help you reach your potential, whatever that is.
I'd say, Jeff, there's a couple different ways of looking at this question. One is at the macro level. So let's think about, is the transit system better today than it was in 2019 if you're a low income worker? No. Is the housing market better? No. Is the job market better? No, right? Everybody is in the macro worse off. In the micro, I would point to two disturbing impacts, long-term impacts of the pandemic. And one is the the workforce downtown and the fact that we don't have the professional workers going downtown every day anymore, that impacts the janitors, the small business owners, all the maintenance workers, and, you know, a variety of people and the spin-off effects from all that. So that is, I think, the unspoken story here about the challenges downtown. And then the other piece that I see is the consumption of space by at-home workers and the fact that folks are moving to bigger homes. They're moving to homes that can accommodate 2 Zooms or 3 Zooms. And so that's why we see in Toronto, for instance, the rise of what we call the school cities renoductions. Where you're taking a duplex or a triplex and you're turning it into a single family home. And a part of that is to move the workplace inside the home. And that then impacts housing availability and housing prices. So these are some of the impacts we're seeing.
We have a number of questions in the back. Please go ahead.
Yeah. My question had to do with some of the issues that people have just been raising here. The downtown and is only part of a city. And I'm thinking of other cities where I've lived, including Winnipeg. I'm curious about what lessons there are if you applied this kind of analysis to areas outside the downtown with an eye to the equity issues that people are bringing up, because I'm thinking the people who were able to work from home are not the so-called essential workers, who are the folks who have paid a higher price in many ways in terms of their jobs during this pandemic. And so the role of occupational health always comes to mind. So, but I'm thinking about what does it mean to look beyond the downtown to see what is going on there? And would you find the same factors playing the same kind of role? And then the other question just for me is the things that weren't talked about that aren't being measured, like which buildings have good ventilation and what does that mean in terms of the kinds of the role that those factors play? Because what you were dealing with is mostly what was done as opposed to what was not necessarily mandated or done a lot, done very often. So I'm thinking about solutions here.
That's great. You gave me 2 ideas for new papers. So, you know, I think we do need to look at neighborhood economies. And I'm actually very concerned with some of some of our more diverse commercial strips that they are more and more catering to the high income stay-at-home workers and the retail uses that served a broader group or catered to lower income essential workers are disappearing, are being gentrified out, right? So I think there's a lot to be looked at in terms of the outside downtown areas. And in terms of indoor ventilation, yeah, this would be great to look at. One of the analyses we've done, which we haven't published yet, is we've linked our work to CoStar building data, so we can find the buildings with improvements and how they're doing versus the ones, class B and C buildings, and compare how they're doing. And I think the indoor ventilation would be a great thing to look at.
Yeah, I think the only thing I can add to that is that, outside of, ventilation and its impact on preventing the transmission of infectious diseases, we know that buildings are also increasingly being looked at in terms of, their HVAC systems because of climate change. So I think there are many opportunities to continue to study this. I don't know that we have all the answers at this point in time, and I may have to partner up with Karen to figure out what papers we might work on and what research we might do to better understand what the current circumstances are and what can actually be done in a reasonable and viable way.
Thank you. We have 4 minutes and 2 people with the microphone. So I'm going to ask each of you to ask your questions And then we're going to hear from each of the panelists, their responses, and then we'll wrap up. Thank you. So please go ahead.
Okay, thank you very much. Excellent talk. I did not look at the methods very in detail, but I would have one question that Aileen and I.
I'm sorry, we can't hear you very well.
Okay, maybe I'll stand up. Excellent talk. I did not look at the methodology in detail, but one question that for the recovery, probably we are not going back to what it used to be. We are building up new kind of kind of balance environment. For example, like, people are kind of working more at home rather than in downtown. But in another measure, for example, looking at the productivity of people whose primary kind of employment address is in downtown, we can probably predict in the future. For example, some studies say even academics, they did not work in their downtown office in the universities, but they produced more papers during the pandemic. So that was some kind of indicator. So I also can think about the future for the recovery theme. It may be kind of rebuild, reconstruct. So to kind of looking at something in the future, that how you could create a new economy during the kind of more digital environment, and also kind of more I would say beneficial for both employers and employees in the new environment after the pandemic. Thank you.
Thank you. And our last question?
Two questions just to throw out, specifically for downtown Toronto. That's where services are. Talking about mental health services, shelter services, all of those services tended historically to be in the downtown. Affordability, now we're moving people out to suburbs and all those wonderful areas that do not have density without services. So that's one, if you could comment on that. The other comment is there's this myth about working from home without looking at, there are a lot of poor people working from home that do not have the second room or working from their bedrooms or all of that. And so I get frustrated where the conversation about working from home is always about the middle and the upper class and ignoring the folks who have grandparents, children into the house and is working from the kitchen table, and the long-term impact of poor posture, that's not part of the conversation. So I'm just wondering if you could comment on those two things, given the work you have done here. Thanks.
Thank you. Renzo, if you'd like to.
Sure. So I think those were interesting answers. Again, my focus will be more from like public health and epidemiology perspective. I think, as the first question was saying, how can we get to this kind of sweet spot between the going back to downtown, also thinking on how that affects people's mental health for those who cannot work from home from the best conditions. And I think it was interesting also when you said that most of the services are centralized downtown. And I was wondering if there is also some space for the services to, the same as we saw the recovery changing and spreading throughout the city, if the services could also go, and this circles back to my point on how can we get the services to the people rather than the people coming to the services and centralize everything at downtown. I understand that downtown has this economic and this has kind of this snowball effect throughout it, but I think the things has already shifted, and I also wonder how the downtown would look now if the pandemic wasn't there. Like, was it gonna just keep growing and getting to a point where it's gonna explode or something, or what is the natural course of what is gonna be? So again, this has been really interesting. Again, from the healthcare perspective, I'm interested into looking at how all these things play around in terms of the economy, how the economy has shifted, and as Jeff was saying, there have been different impacts across different sectors in terms of populations and how working from home and how being in this new space could affect someone's mental health. So again, really interesting points and interesting discussion. Thank you.
So Just thinking through, Camille, you asked a question about, how services are located downtown. We're talking about that. I will say that from my perspective and where we sit as local public health, I think we should, and this applies to healthcare as well. I would say it's not just about that which we do in local public health. I would say that we have not always been the best in the health system in providing the services where they're most needed. I think we should just be clean, come clean on that and say that there's an opportunity to do better. Certainly, when I think about provision of services, and again, public health has a component that is service provision, and a lot of work that we do that is more public health intervention that isn't felt by our communities as a service or a program. But to the extent that we're involved in those kinds of programs and to the extent that healthcare and other service providers provide programs, I think we do need to think more about how we actually make it doable, easier, more accessible for those who need the service most, to actually get it in a manner that makes sense for them and fits with the reality of their daily lives. So that is a constant quest. I do hope that my colleagues, whether in public health or in healthcare, do take up that challenge and take it seriously. I can tell you that's certainly top of mind for me and my colleagues. And it's one of the main reasons why, as the situation allowed and as time allowed, that we have been very conscious about going out and talking to communities after having been providing advice for 3 years about please get this vaccine, wear this mask, etc. We have actually taken the time to go out and say, thank you for all that you did. Tell us what's happening with you and how we might help, right? What matters to you now? I think that's I'd like to think that that's an important component of actually reflecting the lessons that we learned over the course of the last few years. So that's, I think very much one of our key responsibilities. There's much more to talk about. I realize we're short on time, and Karen, I'm going to turn it over to you.
So, and I know we're out of time, but so I would just say that the pandemic was a shock. In every shock, there's an opportunity. And we spent a lot of time reflecting on the pandemic and its impacts, but let's learn from these issues to be rethinking the future for our cities. And now we understand the concentration of services downtown. It was actually great for downtown, right? It brought people downtown. It was very bad for the people using the services. So we need to look, every time we locate a service in the future, we need to think about this. And then even more than the work from home issue is so challenging. And when I think about the future and what work from home is doing, I think about our young people and how are they possibly going to build the social capital and the skills to move up in the world, doing Zoom from the kitchen table. And so when we think about the future of our cities, the future is about the youth, and making sure that they get integrated and have the same opportunities that we all had. So let's take the opportunity of this reflection to make those changes.
Thank you very much. The only thing standing between you and lunch are my brief wrap-up remarks. First, I want to really extend an enormous thank you to our speaker, Professor Chapple, to our panelists, Dr. Calderon Anyosa and Dr. Eileen Davila. This was an incredibly thought-provoking panel. We generated new ideas, I think even new collaborations, and great questions. So thank you very, very much.